Our loving Father in heaven, we are so thankful, Lord, that we could be able to come before Thee this afternoon as a family here. Father, send Thy Holy Spirit. Speak to our hearts and minds, Lord. Help us to concentrate our minds to learn the simple remedies, the treatments, water treatments and other things, Lord, which can be useful for us as well as for others, that we can be a blessing also one day. Father, help us to learn whatever we can, which can glorify Your name. Help us and lead us. In Jesus' precious name I pray. Amen.
Amen.
There's a request. Before we start, I just want you all to be a little attentive. We are not coming here to play. Yeah, you have break time. You can play, laugh, giggle, make jokes. But when class is going on, please be attentive, because that disturbs the people who are in the front while teaching. So sometimes what we wanted to say goes off when we see some disruption. So it's our humble request, please be attentive during the program going on here. Okay. Last week, what did we see? What did you learn? Raise your hands and give, because this video is going, audio is going, and when people watch, they should know that you are all good ones. And now, no hands? Yes. Cold compression? Anybody wants to? Heating compress. You can teach us later, okay? Okay, what else we saw? Heating compress, where we can do? Huh? Neck joints? Okay. Abdomen? Knee? Chest? Okay. So did you all practice last week? No? Who did not practice? Okay. So what we can use this for? Huh? Cough? Pain, okay. That inflammation, tonsillitis, okay.
Headache.
That is hot foot bath. Let it be clear. They also will no.
Somebody told me. Joint pain.
Joint pains, yes. Okay, we saw only the demo of the neck, and some people, they tried the hand, right? So today we are going to show the chest as well as for your knee or elbow and for your abdomen.
Did you want that one for the joints? It's right there.
Okay, what are the three things we needed? Cotton cloth, plastic, woolen. Okay. If you don't have a woolen cloth, what you can do? You can use woolen socks also. If you don't have that cotton cloth, you can use cotton handkerchief also. Or if you have the cotton sari, that also you can tear and use. Okay. Oh, we have pin here already.
Yeah, that one has pins. This doesn't have pins.
I'll ask one person to show. So in that way, that students also will be involved.
You can, but do they know how to do?
Last week they were doing for them. Okay, the three things are here. What should I do with this? Cold water. Then? Okay. Then?
Your sister's dripping still.
Oh, hearing you, I did not squeeze properly. It's dripping. But for a thin person, you don't need to be too long in. According to that, you can cut.
This one is very long.
Yeah.
I think this would be good for 2 or 3 of me, but for some people, not like that.
I know, this is fun.
This is not the easiest plastic
Yeah.
ever.
Please, this guys.
We always have.
We are having mic.
Sister.
We have to be careful.
That's good.
No, just we wanted to finish off lead. But you do with a good this is a good plastic, but sometimes it does its stubbornness, no?
We have a joke in US that there's always a battle between the man versus the cling wrap, and we have to see who will win, the person or the cling wrap.
Meanwhile, if you have any witness or any sharing, you can talk about this. That also will be good without wasting that they are making fun of us.
Yes.
You start anything if it is there while I was making this.
Yeah, I don't have experience with using this on the joints actually, because I don't have joint pain. But I know Sister
knee?
Lorna. Yeah, Sister Lorna has used it on the knee.
That you share, that you share.
Yeah, Sister Lorna told that she often uses this one
Loudly.
on her knee.
To everybody.
When she has joint pain, she puts it on and it takes the joint pain right away. So I don't have joint pain, so I haven't had that experience myself, but I know that it's very helpful. Does anyone remember how this works to take joint pain away? How does it actually help? What is the physiology?
Remember the physiology class of physiology of water she took, no? You don't remember things? I'm sorry. I only gave the, she asked the question. Sorry.
No, but
Okay, but let them bring that word.
yes.
Ask.
So remember, what does hot water do? What does cold water do? Now when we put this on, what temperature is it? It's cold, no? But does it stay cold? No. Yeah, it heats the area because this is going to heat up the whole cold cotton cloth. And as that happens, where will the blood go? Yeah, the blood will come to the surface, right?
First it constricts, right? And then after that, to heat it up, this wool helps. So what happens? It opens up and then that place will be heated up.
Okay.
This is,
For the joints, no?
yeah, the same way you can wrap it on your knees also. Now for chest.
So
Yeah, go ahead.
there are different ways you can do it. You can wrap with a cotton cloth, but a very simple way is to take a thin undershirt and dip it in water and put it on.
A sleeveless t-shirt, if it is cotton one, you put that one inside. But now the inner one we are going to put, please don't laugh.
Immediately they will laugh. No?
Should I put or
You
try
can
on the-
So,
Oh, fancy
ooh,
put.
cold.
Oh, nobody is asking any question. I'm just putting.
You have to dip it in the water now.
I was trying to check, but nobody is opening your mouth. You're telling bye?
No. You should not do right after the meal.
Squeezed already. You put your hands. Wait, that is one hand.
You should not do after the meal or your blood will all go for that area, no? Okay. So, of course you'll put it next to the skin, but we won't demonstrate like that in the class.
But we are not putting the plastic here.
The plastic, but we can. Plastic is there.
This you want to wrap?
Ah.
Any volunteer? Ah? No. Here this is a dry demonstration and we are showing on her. This one you should put on your bare body.
Ah.
Till that cold cloth should go on your skin. Then only it can be able to do its proper work.
Should you put it on somebody who is already cold?
Can we? Why not? Huh?
That person will be able to do that.
Yeah.
Good.
If they're too cold, give them a hot foot bath or something first.
Oh, I'm going to wrap this one. Oh, I'm going to wrap this one.
Easily, no?
Your hair. No, you come here. This one take. It's like
Then you go around the middle and then go up the other side, no?
Wait. Don't. It's too much tight. It shrinks. So I just imagine that I have put the plastic.
Okay.
Yeah, otherwise it will not nice.
Okay, that's fine.
Okay, now you imagine that I have already wrapped with the plastic, okay? Thank you, Sneha. And after that we told like the woolen one. If you don't have that thing, you can, I told like woolen, sweater or high neck, how are you going to get this one?
Turtleneck. Simple. You just put
Some
it
people
on.
they say like turtleneck sweater, right?
Yeah.
And
High
some
neck.
they say high neck.
I don't think
So
we need.
beautiful with your face color and this color. Oh, this one? How to remove it? Let it be inside.
Okay, no problem.
Now blue color and red color.
Okay.
So now abdomen, right?
Huh.
have a cloth.
So if I was actually doing this,
Yeah, lay down. Oh, but before that I have to put the cloth. Where is that cloth you said? This one.
yeah. So what are you doing now?
Wait, I put the blanket first.
Okay.
Let me see whether they are doing chicken.
Okay.
Let me check. If they are guiding.
That's for the neck.
Huh?
For the chest and why again for one.
This is for your abdomen.
You didn't say that, so I'm asking.
I said it in the beginning.
You guys say,
You are not listening.
Okay, so first you're going to put like that.
But they are not telling anything. She has to lie down. And before she lie down, I have to make this one ready. Is that all right?
Okay.
They are telling yes. Then? I was waiting for that. Everybody is telling yes. See what we saw? The woolen should be on top. And this one lying down, the woolen should be down so that when we wrap, it come on top. Yeah, but now you have to imagine the plastic. It's not working with us.
You can put. No
You
problem.
have to go the other side. So
Okay. Okay.
Yeah.
You want my head this side?
Yeah.
Okay.
Or let it be near the tummy. It's coming.
Okay.
Yeah. Oh yeah.
Okay. Should I keep my arms down or up? Okay.
After that, there will be a plastic. Okay. Now you put imagination, and then cover the wool. she's going to be too hot and her face is going to
Yes, it's working very well.
little side. You're pulling my dupatta also.
Sorry?
My dupatta is pulling along with you. Now you go the other side. Now you turn the other side. Little bit carefully you turn the other side. Careful. Okay. I'll put the pin. There, imagine.
You can imagine the pain's okay. No
Okay. So how long we can leave this person? The whole night, right? But for this person, but when you are doing, she already mentioned, you have to check whether the person is warm or cold. And if it is cold, what you should do? Steam? Yes, hot foot bath to make the person to warm up, and then you start this one. Okay, now 8 hours over, this person is getting up from the sleep. Huh? Steam bath. But that will be too much for them, for the patients.
No, you can do, like you could do a hot bath, you could do any body heating treatment.
Fermentation also they will do. They'll do fermentation also to heat up. One at a time, please. Yes.
Only you need a warm
But the
patient.
room should be warm and without draft.
If the plant is not heating up, can we put more blanket?
Yeah, you can cover some more.
Yes.
Yeah. Okay, she's getting up early morning.
Good morning.
Then unwrap things. If you have any questions, you can ask to the client. Put your legs down and sit. Put your legs down and sit, and then.
Rested and refreshed.
So now what's the benefit of doing this?
Nobody's asking.
Just for fun. No. No. Okay, so if we're putting for the chest, what kind of treatment, what kind of sickness might we be treating? Think. Cough, yes. Yes, but
Also-
more for the lungs.
Also congestion.
Digestion?
Congestion.
Digestion is here, not here.
But for the abdomen, it can be like if you have inflammation in the bowel, if you have different, even pelvic pain, different things like that, the abdominal compress can be effective.
What about gastric?
Yes, it can be. Abdominal compress can
You know why
help
he's
with
asking
gas
all these
trouble.
things? He's undergoing that problem. That's why he
Okay.
wanted the remedy.
Tonight, Rengpa's homework is to do abdominal heating compress.
And tomorrow he's going to tell you the result.
I'll take the
You have in your room.
No, wait.
Every blanket have it.
Okay.
You have a blanket given no to sleep?
The cotton one he needs.
We'll give after.
Okay, no problem. Not necessarily.
Anytime you can do, but night it will be easy so that after applying you can go to bed and you will sleep nicely, and morning when you get up you can remove. But daytime you feel like little bit uncomfortable, little tight, like when you walk or work things. But if you want you can do. Even for work you can go also. Till that inner cloth get dry. And if you want still more that heat needed, then you remove again and squeeze and put again, like if you want like extend it.
So one version of heating compress that is full body is called the wet sheet pack, and we won't be teaching that today, but we may
It's a
teach it
last.
later. And you would only do the wet sheet pack after a body heating treatment because it's the whole body in wet. And with that one, you're already sweating, you're already hot. And so an hour or hour and a half usually is all you need for that to become hot and dry.
One more thing, when you are doing abdomen, we put the wet cloth, no? Some people, if they have problem in the abdomen, they will teach you at the end like about the charcoal poultice. That also can be applied.
You can put different kinds of compresses on the abdomen, different kinds of poultices. And we're going to have several classes on different kinds of poultices before the end.
Yeah. So the client, my help guest is doing good, so we can send, oh, he has some work.
You said about charcoal for this. That is alternative day. One day charcoal for this, one day hot compress.
No. If they have like some other complications or something like that, for that they'll put charcoal potties. What charcoal does, like it absorbs and takes off the unwanted things or poisons, those things.
But you
so
could.
that will be taught later.
But you could combine, in other words, putting a charcoal poultice and then wrapping it like a heating compress to add additional warming. You could do that. It would be okay.
What about the finger, the finger joint part, like this finger?
If you wanted to treat the joints of the finger, then you would need to make yourself a very small heating compress. So you need to get a handkerchief and cut in small strips, and you can wrap your fingers and treat.
Otherwise, we have to fill a tub of this height mixed with charcoal, and we have to make him to stand there. If anything is there, it'll absorb and he'll be clean. Okay.
No, baby, we will also be showing you the contrast hand bath very soon. So you can also do that for joint problems.
In the beginning, I have told, like, if you have any doubt, we both are here, you ask here. But not to the next person telling and then that person asking. Go straight, we are available. This I told last class itself. What is your doubt now? Bring out.
Someone has a doubt.
Whoever was telling, no, somebody's pointing towards you, somebody's asking.
For what other problems?
He was not there, maybe in last class. I think.
Like with the charcoal politics is really helping in healing, or charcoal politics is only extracting the toxin, or
Well, when you're extracting the toxins and decreasing the inflammation, you are definitely helping in healing. So, yeah, if your body has poison there, it will not heal. There are many, many different methods.
And they will be teaching one by one. So you will know many things you will learn before you leave from this place.
We will cover quite a few poultices, but I'm sure there's quite a few more that we can cover.
Okay.
Yes, it can be helpful for constipation.
Don't call his name.
For removing toxins, it's not so much for detoxifying because it doesn't cause general sweating. If you want to detoxify, a wet sheet pack is better, or a Russian steam bath. But yeah, not so much this one because it's not as. So you all have your book, right?
Did you bring your book or not?
So we are having some questions about when to use this. So we covered it last time, but chapter 12, the heating compress
Because
section.
those who did not listen, those who have not gone through the book after going home, please listen
It's
now.
there. So abdominal compress is good for constipation, hepatitis, that's inflammation of the liver, inflammation of the small or large bowel, nausea during pregnancy, colic, difficulty sleeping, and nervous conditions. So it can help with quite a few things. Now, one thing I read this week is that heating compress, Dr. John Harvey Kellogg, who did many great things before he left the church, but he had a wonderful experience in natural remedies, and he said heating compress is a very powerful remedy, but it's one that can be very detrimental if you don't do it right. So if you don't keep it snug, if you don't keep it covered and the air blows inside and chills the client, then it will cause more damage than good. So you need to make sure that you're applying it correctly and not letting the client get chilled by it.
Also, I forgot to put this one, but since she has that high neck, you can put that wet cloth and then the plastic, and then if it is like fitting tight, you can leave that one.
Because
no
if
need to put this one.
If you're using that for cough and cold, you'll want to do the throat also.
Like
So-
same time, if you wanted to do all these things for cough and cold, congestion, or some stomach.
So, ma'am, I'm feeling quite a bit better. Would it be okay if I remove my heating compress?
Yes, yes.
Oh, I thank you.
You're welcome.
Okay, very good.
You can ask 1 or 2 questions now and then we can go to the next.
Okay, so just reviewing, heating compress has how many layers? 3 layers. Okay, very good. Which layer do you wet? First layer. Okay. The thickest layer is on the inside? Okay, just checking. So why would you use heating compress on the feet? Feet.
Feet.
Headache? Yes. Fever? Possibly. So here it says it's the same thing as hot foot bath. Same kind of conditions that you're treating with hot foot bath is heating compress on the feet. But especially for who? What group of people? Yes. Children, when it's very hard to make them sit and keep their feet in the water, heating compress on the feet is very good. Okay, so we learned how to do abdominal, elbow, throat, chest compress. So these are all important ones. I would recommend that you practice them on yourselves and on each other. We're not going to take time to do all of them in the class practicing, but I would like to have each one of you practice it and see how it goes. So you've done already 1 compress, and this is a very simple treatment, but try it. Try it on your chest. Do it one night and just see, do you get chilled? Did you wrap it tight enough? What happens? You don't want to wait until somebody's sick and then experiment on them. You should know ahead of time.
Every day, try to go through at least once or a little glance what we are teaching. Because suddenly when the test comes, you no need to go and hit your head on that.
But you know, suddenly when the test
Even
comes,
electricity goes also, you no need to worry.
But you know, the sudden thing about the test is that suddenly the test may come in your class, but that's not the real test. Suddenly the test comes when you come home and someone is sick. And what are you going to do? And what was the remedy that I was supposed to use for this? And I don't remember how to do it right. And that's when the sudden test really comes. So now we're giving you little artificial tests so that you can know what happens when the real test comes.
It's warm. Let's see whether the
I'm sure
redness
it's
is
warm.
there.
Yeah, it's also wet. Okay, so we have a few minutes left before our break. Shall we go for our next demonstration?
Yes. Why we should not use this one in the classroom? Huh? Distraction. Already it is distracting some people and it is distracting us also. So next time, if we see somebody using, you will not get it back.
We have to impound your phone like they impound a car. That's very serious.
Some are not serious, that's why.
Okay, so our second treatment that we're going to cover today.
Oh, we did not put the water. Oh no. Oh, we forgot all this time. Shall I put?
Put. But we can do it in different ways, no?
The kettle we did not bring, no?
It's there on it. You have so many of them right there. So our next treatment is steam inhalation. And I'm not sure that there's a chapter number on this one because we added this one. It's under supplemental treatments. It's your second one. Steam inhalation. How many of you know what steam inhalation is? Few of you know. How many of you have done steam inhalation?
Because of COVID, everyone will come.
Exactly. I know during COVID I did steam inhalation probably twice a day, almost every day, and especially after I had gone outside, right? Just for prevention's sake. So what is the proper way to do steam inhalation? And why do we do it? When do we do it? Okay.
Before you go through this book, so many would have experienced, right? Open your mouth. This is the time you can share.
When did you take?
Steam inhalation.
COVID.
Tell.
Quarantine, even though you don't have positive.
But before COVID comes, you never used? Nobody? Yes, please open that one. Let them also.
Cold, fever,
Cold,
sneezing,
Running nose.
running nose.
blockage also.
Yeah.
Blockage, congestion. Yes.
Headache. No, not so much headache. Headache, I would be
Headache
careful.
maybe because of that cold. If
Yeah.
that, yeah.
If you're having allergy headache, yes. If you're having congestion, sinus congestion headache, yes. But if you're having a headache from too much stress and the blood is pounding in your head, would you want to take steaming? That time it would make your head heat up, so the blood will come to your head more. So for that kind of headache, it would make it worse. Okay, so what is steam inhalation? Very complex definition.
Be serious.
What is steam inhalation? Yeah, you have to breathe in that air that's loaded with hot steam, hot moisture. And what does it do? It can help with cough. It loosens the mucus, helps with a dry cough. It relieves irritation, and it gets rid of the mucus. So there's a lot of different things that it can do. I know for allergies, it helped mine a lot. But as we all learned in COVID, it also sends heated steam into your nose and kills anything that might be in there. COVID doesn't like heat. Many bacteria and viruses don't like heat. So it's a great way to not only treat sickness, but prevent sickness if you know you've been exposed.
Tell them a little more easier way to understand.
Tell them about mucus.
Some they will find difficult to understand.
So what is mucus? Mucus is what comes out of your nose when you are sick or sneezing. Yeah. And if you are sick, it tends to collect inside of your sinuses. So when you're sick, usually your nose will run and then it will stop and your head will feel like full, right? You can't breathe. It's just so packed. At that stage, if you take steaming, it will help to clean it out of your sinuses. And then as you're healing, normally anyway, it will come out and then slowly everything will stop. But steaming helps to get that out.
So when your nose is blocked, how do you breathe?
Through your mouth.
In the night, you open your mouth, right? And you find difficult. So this helps the time.
Snoring will definitely come. So if you are experiencing throat pain, inflammation, congestion, cough and cold, even a chronic or acute inflammation in the sinuses and the bronchial
What is
tubes.
chronic and what is
Now what
acute?
does chronic mean? Long term. Yeah, it keeps on, keeps on. So if you have a cough for 1 day, is that chronic? No. What if you have it for 1 year? Yes. So if you are having a cough for like 1 month, 2 months, it's gone from being quick to being chronic. So if it's not chronic and you have it for only a short time, we call that acute. It's a short, intense sickness. So either, whether it's an acute inflammation or a chronic inflammation, steam inhalation can help. So I want you to remember some of these words just because it's helpful for you to know in your medical experience. What is chronic? What is acute? What is inflammation? Some of these terms you may find on a test, but more likely you'll need them in your life. So even if the patient has very thick or dry mucus, which COVID does have very thick mucus, but other diseases do too, it's very helpful. Steam inhalation is helpful. So what should you be especially careful for when you're using steam in a treatment? What's the danger? Steam is really hot, right? So if you are not careful, you can burn the patient. Steam is like the most effective way of transferring heat through water.
Steam is that hot vapor, right?
Yeah, because water, if it's very cold, what will it look like? Ice. It'll be solid, right? You can hit it. Then if it heats up, it'll become liquid, right, first. And then it'll slowly get hotter and hotter, and then it will boil. And when it's boiling, what's happening is the water molecules are turning from a liquid into a gas. And so it starts boiling more and more and more, and as it's boiling, the water is becoming a gas. And as it becomes, it has a lot of energy. When it hits your skin, you get all that. So it heats you fast. The vapor will heat you faster than the boiling water. So if you suddenly put boiling water on someone, you can burn them, right? It's the same way if you're not careful with the steam, you can burn them. So when you're doing steam inhalation, it's very good, but you need to be careful that you're watching that the patient doesn't get burnt.
But all this water treatment, you have to be very careful. Watching the patient, that it should not go worse.
And most of the time they won't go worse, but if you are careless, that's when there's problems. Okay, so check the patient often, make sure they don't get burned, and especially if the patient is a child, why would it be a danger for a child? Sometimes they don't realize when things are getting too hot. I had an experience with my father that I would not like any of you to have. Because my father has a special condition, he has a brain injury, as I shared with you all. So because of his brain injury, his brain doesn't always pick up everything. So when he and my mother had COVID, I was there, thankfully I was there, and I was giving them treatments. So I took steam inhalation and I told my father, please take. And if you get too hot, immediately you come out of that tent, you don't stay in the steam. So my father came out of the steam, but his brain didn't perceive that he had had too much before he came out. And then he got a bad reaction to that. So when you are dealing with a child who can't express or someone who might be disabled, you need to take extra care. Just like if you're putting a diabetic person's feet in hot water, you know they can't understand how hot it is. So the same way if you have a child or someone who's disabled, you have to be the guide for them. They can't tell you. So how are we going to do this treatment? It's actually quite simple. But there's different ways you can do it. We're going to demonstrate several ways. So we have, probably many of you might have done steaming using just a pot of water, right? You can use like a tea kettle. You can use the boiler that you plug into the wall. You can use a stove like this. There's many ways to heat the water. So we're going to show you a couple of them. Yes, you can. Now there's different kinds of steam inhalers you can buy. Some of them actually heat the water, and some of them just create a vapor without actually heating the water. So I also have a vaporizer which you can use for essential oils, but that's not hot steam. So I use that, but if I need hot steam for treating something, I don't use that. I use one of these other methods. So we have here water that is heating. Is it hot? Not very hot yet, but it's getting there. So that one will take a little longer. The water boiler will take a little less time. So we're going to set up everything, and by that time, hopefully the water will be ready. So what do you need? There's several ways you can do it. Yes? Can we do what?
Can you add herbal leaves?
You can add herbal leaves. You can also add essential oils. So like, we're going to put probably some eucalyptus oil into the water. But if you were to go outside and pick eucalyptus leaves and put them into the water, that would also give some of the same oils coming out, especially if you pounded them. So you can add herbal leaves, but you would again want to make sure you know the leaves you're putting in are helpful and not toxic. Okay. So, if you're going to do steam inhalation, you can do it the simple way. Just put your pot here, cover your head, and breathe the steam. But when you're doing that, do you want to just breathe through your mouth? You might feel like breathing through your mouth, right? Because your nose is plugged. But it's best to breathe some through the mouth, then plug one side, breathe through that side, plug that side, breathe through that side. And I don't know about any of the rest of you, but I find that when I do steam inhalation, really, I need a tissue box or some tissue or some handkerchief here. Because when you start breathing in steam, you're going to immediately want to run and blow your nose. And you don't want to get out of the steam inhalation every 2 seconds. How long should we do steam inhalation? 5 to 10 minutes? So 10 minutes is a good rounded number. If you do for just a couple minutes, it's not long enough to kill everything. 10 minutes is a good guesstimate. Can you go longer than that? Yes, you probably could. I've seen some books that said up to 30 minutes. I have never done it 30 minutes. But I know 10 minutes is a good number to go for. So one of the things that you'll find is if you're not keeping the water actively heating, after 10 minutes the steam will decrease. You won't have as much steam that you're actually breathing. If you are keeping the steam actively on a heat source while you're breathing it, you want to be really careful that you're not burning yourself because it'll be really hot. How is the steam going? Still?
Just it needs some more time.
Need some more time?
Yeah.
What about that pot?
That one now only we put now.
Okay.
You put it in 180, and now I increase. Put it in 2000. Then it will be the.
Okay. So sister, shall we demonstrate how we're going to do for someone who, suppose someone is too sick to sit up. They just feel so tired, they don't want to sit up.
That umbrella one, yeah.
So what are you going to do for them? If they're lying in the bed, the pot is over here, and they are here, what are you going to do? Okay, so we need a sick person. Who will be our sick person? Rangpa, are you feeling sick today?
He's thinking. That means he's not ready.
I am ready.
Okay. So, Rangpa is sick. He's going to be laying on the table for us. Sheet. You want to put the sheet down below?
This one thin sheet, no? Of this table size?
Like this.
Yeah.
You want that one? That striped one? No.
Okay, he's already lying down. Just
So you need to lay face up or on your side, as you like.
I don't know.
Okay?
Is it like
Side,
That's
side,
fine.
yeah.
That's fine.
Side.
So we're going to take an umbrella.
Side or like back.
This is a big one. You don't have to have it quite this big.
Side will be easy because that vapor will go.
I'm having fever.
Okay. So you want to take that, and then you're going to create a tent using a sheet. So you don't have to cover his whole body, but at least his head and the umbrella, right?
Yeah,
This
that's why we
umbrella-
are going one side. Oops. One side we are showing. Okay. So imagine that umbrella will be small and this sheet will be big. Rebecca, you have to come. Okay.
I have to do
Or
what?
you hold the
Yeah.
umbrella.
Okay, now we got it.
No, so imagine this a big sheet. It's covering full. It should be covered. Okay.
I think if we just turn it the other way, no?
Which way? The other half.
In other words, long way is
This
this way.
side.
See, this side, this side.
You pull that side.
Pull.
So now we have created
Right.
a tent.
No, here it's see that
What?
it cannot cover.
Wait.
No. Let it be now. No. Let it be now.
Hold so that the umbrella will not move.
Okay.
Hold. Now the umbrella will not fall.
Okay.
So this will give you some idea like which umbrella we should put and
So now you put your steam kettle right here. And the steam is going to go up and it's going to go right to him. It's not going to go out into the room.
imagine here there's a chair and you're putting that here so that it will go to the nose and chest or neck. He said it's somewhere there.
It's a drink.
Oh, she's bringing the smaller one. You can try.
Let's try it. It probably works better
Wow,
than this one.
color is
This
going
one is
now
like
to
for
black
3
and
people.
white.
Can we use kilo?
Yes.
Put your
you can
hand,
use a
this hand,
pillow.
no, under. For your hand, put that one, yeah. That's it. Here. No, it's done. It's done. It's okay. No.
There. So now we have a smaller tent, and probably this would be better as well to keep the steam closer.
Hey, no steam. Steam will come now, Grandpa.
Steam is
It's
coming.
coming.
Okay, so let's do this. We have a little table here. Pretend that it's a table and not chairs. And we're going to bring this one there.
No, only part you.
You think the pot can sit on that?
Yeah.
Just put a towel.
Oh, wait.
So then you're going to remove the lid from the
Cover in
pot.
chair. We can just cover the pot.
Yes, I'm removing.
Yeah,
Huh?
Just cover the pot.
if it will go down far enough.
Take over.
And then the steam will go directly to the patient. But it's not so close that you're going to burn him because it has a little distance. If his face is that close to the steam, you have to worry. How is that, Rangpa?
You're enjoying?
I'm getting hit.
You're getting steam. Very good. Now, I personally have never done steam inhalation this way because I'm usually sitting up. But if you do have somebody who has to lay down, this is a valuable way to do it.
Grandpa, don't want to get up.
Okay, Rangpa, I think you're recovered now. Thank you for your assistance.
Done.
Yeah, you got well. You can get up. ஆமாம் அப்பதான் அது உள்ள போகும். Okay, when he's getting up, what it was supposed to do after?
What?
See, with the umbrella only is going like that.
I know. No, we should remove. Okay, here. What could we have done differently to help the client not fall off the table?
The assistant.
What if we
need to be careful.
What if we remove the umbrella first? Would that help him? Or if we stabilize the table as he's getting down? Some things we could do, right? But maybe we didn't know he's going to tip the table, so we didn't know to do that.
This
but-
one? From here or what? Here. Ayyo, that is another student's packet. Don't remove like that.
Okay,
He's here. This towel? Whose towel?
that's mine.
Okay.
Okay, so now we can demonstrate how you do the real steaming.
Okay. So should we pull this one and sit in the chair? At present, we can just put that beside us. No.
Sorry?
Okay.
You wanted to put it what?
No. Which one you are going to show? Sitting one or what?
Yeah.
Yeah. So this one no need. No. We can go to the front. Or you. Put
Where
this-
you're going to put the steam?
Oh yes, on the table. Maybe here,
That's
so
good.
that we can put the top.
Okay.
Hold your arm again. Careful.
But then you should have asked immediately. No. Nobody. That's what. Nobody's doing anything. So I have to know. Now you're doing after I get problem only. You're telling.
Okay. It's on. It's okay. Good. It was boiling. That's good.
Rebecca,
Yes, ma'am.
we'll just give 5 minutes break. Let them go and come.
Okay.
By the time we will keep ready.
Okay. Fine.
5 minutes break. You can go and come back.